Now, for another thing that could actually help us to be able to diagnose pregnancy, we are looking at what is known as what? Auscultation for uterine souffle and Funic souffle. Right? So, of course, even if you have never heard about anything that has to do with this, you know that, of course, it's trying to talk about, sounds, possible sounds you might hear, that will help you to be able to diagnose or confirm pregnancy. So, auscultation for uterine souffle is what? A clinical technique. It's used during pregnancy to dictate a very soft, blowing sound, and this sound is produced because what? The blood supply to the uterus is kind of like increased. The blood vessels are dilated, So it's considered a probable sign of pregnancy. Do you understand? It's kind of like more of a definitive sign of pregnancy than saying a woman is vomiting and she's pregnant. Do you understand? So what is uterine souffle? It's a low-pitched blowing sound is usually heard over the uterus. It's synchronous with what? The maternal pulse, not fetal heartbeat. So it's best heard using what? A stethoscope, okay, or a Doppler device. Okay, and these are the different places where you might actually want to place it. Okay, but it's mostly done up here though. But you might actually want to still place in different places. So how is it performed? The examiner places the stethoscope over the lower uterine segment. Okay. Then simultaneously palpate the maternal radial pulse. So you are palpating the radial pulse. You are doing this to see if they are going together. Okay. So the sound is distinguished from Funic souffle, which is sharper and synchronous with what? The fetal pulse. So Funic souffle is synchronous with the what? Baby's pulse, not mother's pulse. So clinical significance indicates uterine vascularity, shows you that what? The blood supply to the uterus has increased, like it always does in any pregnancy. Helps to differentiate between maternal circulatory sounds and what? Fetal circulatory sounds. So only this one can actually confirm that there's pregnancy. So you have to now what? Do other things to further confirm. So the main differences between uterine souffle and Funic souffle is this. Origin, this one is maternal arteries, while this Funic souffles is from the umbilicals that are formed joining the mother and the baby. Pulse synchronous, this one it goes together with maternal pulse, while the Funic souffle goes together with what? The heartbeat of the baby. So sound quality, this one is soft, while this other one is whistling. Timing, like you mostly see it in second trimester. Okay, this one too is also from second trimester upward. So that's it for these two sounds, okay, heard during pregnancy.